What I like to advise people is that anytime that you reduce the size of somebody's jawline, you are in fact relying on somebody's skin and muscles to be able to contract around their new jawline. And it tends to fairly reliably happen on patients who are under the age of 35 or late 30s. One thing that we've been able to do is do a bit of an internal lift when we're closing the various incisions we have to use in order to access the jaw. We're able to actually elevate some of those tissues to essentially obviate some of the need for more traditional cosmetic surgery procedures. If all of that fails, and say for instance a 40-year-old patient comes in and despite everybody's best efforts they do have some laxity, then certainly there are more traditional operations like a facelift, neck lift to tighten the lower third and the middle third of the face that are very viable options for patients. And these are all things that can be done. One thing that I've had some issues with and take some issue with is it's an operation that needs to be done after all of the swelling has resolved from a jaw reduction procedure. And so the time to do a facelift or a tightening procedure is not at the same time that you've just created an immense amount of swelling by way of doing the jaw operation. It should be staged, and this is the right way to do it. If one were to do a skin tightening operation or a soft tissue tightening operation at the time of jaw contouring, as the swelling from the jaw contouring will go down, most patients will realize that they have very early recurrent laxity of the lower third of their face, and that's why these two procedures should be separated by a minimum of 6 months.